Welcome, Dr. Julia Marcus, and welcome to all of you who are joining us via Zoom. I am Mark Levine, City Council member from Northern Manhattan, and also chair of the City Council Health Committee. Welcome back to another one of our live Q&As with the people leading the fight against coronavirus. And I am really thrilled that we're joined today by Dr. Julia Marcus, who is on the faculty at Harvard Medical School. She is an assistant professor for population studies, and she has focused her research on HIV prevention, and we hope she'll say a word or two about that. But she has risen to national and even international fame in the last 2 weeks after she wrote a very influential article in the Atlantic magazine. And it's so relevant to what I know all of you are feeling right now as we are over 2 months into social distancing here in New York and in so many other parts of the country and world. And we are very social creatures, we human beings. And so this has been tough. It's been tough to not have any in-person physical contact. And that's what we're going to talk about right now. How to navigate that, how to understand the risks of social contact in the real world, and how to recognize that as human beings, we're just not all going to stay inside locked in our apartment. And I'm thrilled that Dr. Marcus is here to talk us through this. We're going to put the link to her influential article called Quarantine Fatigue is Real in the chat. And Dr. Marcus, we like to do a little bilingual thing here. And so we're thrilled that your article has just been translated to Spanish. So I'm just going to say a few words about that. Bienvenidos una vez más a otra charla con los líderes que se están enfrentando a la pandemia. Hoy con ustedes la profesora Julia Marcus, que hace poco recientemente escribió un artículo en una revista Atlantic acerca de la cuarentena y de lo mucho que nos estamos cansando de esto y cómo podemos manejar con nuestras relaciones sociales durante esta pandemia. Y resulta que ha sido traducido ese artículo al español y pronto le vamos a poner el enlace en la charla. Así que ya lo van a ver. Dr. Marcus, can you unmute yourself?
Yep, can you hear me okay?
We sure can. Welcome and thank you for joining us to talk about a new approach to thinking about social interactions in the pandemic era. So I'm going to pass it off to you. Could you tell us a little bit about yourself and how is it that someone who's known for AIDS research has now become an important voice on the current pandemic? Please take it away, Dr. Marcus.
Sure, and I'll just say if I end up freezing or glitching, just let me know. We're having some Wi-Fi issues over here, but I can always call in if I need to. So thank you so much for having me. It's really an honor to be here. And yeah, I'll just say a little about myself. I'm an infectious disease epidemiologist, and as Mark said, I mainly work on HIV prevention, and so what I wrote about in the Atlantic was coming from that perspective and just sharing what I know about what has and hasn't worked in terms of fighting the HIV epidemic. And I think, these are very different viruses, and so the analogy only goes so far, but I do think there are some important lessons to learn from other epidemics that we've been working to prevent for decades. And so as Mark mentioned, I talked about quarantine fatigue, this feeling that I think we all have at this point. And I want to highlight that I think the stay home message was really important. And when at the beginning of March, when that was the main message out there, that was what we needed. And now we're a few months into this and a few things have changed. One is that we're realizing we're going to have to do this for much longer than I think any of us expected. And so it's become really important to think about sustainability because we may have to do some amount of social distancing for quite a while. And then the other thing is that the science has evolved really rapidly over the last couple of months. There's a lot we've learned about this virus, and one of the things we've learned is where it's most likely to be transmitted, what the highest risk situations are, and what some lower risk situations are. And so I think now it's time to adapt our messaging to those two new things, this idea that we have to do this for a long time, and also that we know better things that we can do that are lower risk, if not, they may not be zero risk, but they're lower risk. And what I talked about in the article in terms of HIV was just what we know about abstinence-only messaging. When we tell people don't have sex, that generally doesn't work for everyone, and it's not sustainable for the long term. And I think similarly, we can't say just have no social contact because it's the safest thing to do. It may be true, and every social contact you have may increase your risk a little bit, but we can't all just stay indoors forever and not see people. It's just not. And of course, this hopefully isn't forever. This is till we have an effective vaccine and can ramp up other public health capacity that we need. But it may be quite a while. And so now I think we need to start thinking about a spectrum of risk, not just staying at home or going back to business as usual. Both of those things, or neither of those things, are really feasible options. We can't just fully reopen and go back to the way our lives were before, but we may be able to find ways to get enough social contact in a way that's fairly low risk in terms of coronavirus transmission, that we don't feel the need to go to crowded bars and have house parties and do the things that we used to do for pleasure. We may be able to get enough of that from lower risk situations. And so that's kind of where my focus is trying to help communicate that spectrum of risk so that people can figure out where they can be what's the lowest point they can be at that spectrum of risk where they can sustainably live their lives until we're able to come out of this whole situation.
Well, that's a great introduction to the big picture. I want to remind folks that you can ask questions of us, of Dr. Marcus, by putting it into the Zoom Q&A, or if you post them on Facebook, our staff will make sure we see them as well. And a few of you already in with questions prior to starting. So I think you made such an important point, Dr. Marcus. If you tell people that risk is a yes or no thing, or a binary thing, or a black and white, or on and off, whatever way you want to describe it, it's, boy, that's tough to take. It makes it seem like unless I sort of barricade myself in my apartment, anything I do could be horribly dangerous. And my goodness, how can I survive that way indefinitely? And as you mentioned, a more extreme approach really was necessary during the peak of this crisis, starting in March and April. And boy, it accomplished pretty big things in New York. We have so dramatically slowed the spread. I mean, there's just endless number of statistics, but the number of people being admitted to hospitals in New York City with coronavirus, with COVID, is down well over 90%, I think 95% down from this peak. So that's thanks to the hard work that everyone on the Zoom right now and people around New York City has done. But now we have to hunker down for the long haul. And as you have correctly helped me and other people understand, Dr. Marcus, it's not enough just to say you can't have any social interaction, period, ever, because that's not how human beings can function. And you've used a word which I've really picked up on, which you describe risk as a spectrum. And which means we have to understand things that are the most risky and less risky as we make our judgments on how to go about our life and how to connect to people that we love. Can you explain how you think about that spectrum and what you put on the less risky end, what's in the middle, what's on the more risky end? How can we understand that spectrum?
Yep. Well, if we talk about it just in terms of, let's say, socializing, you could think of a spectrum of risk in terms of social contact, anywhere from I'm in my home by myself to I'm at a really crowded house party in an enclosed apartment with none of the windows open, and we're all shoulder to shoulder. So that's like lowest risk to highest risk, but there's a lot in between. So you could think about going for a bike ride with somebody. That's a fairly low risk activity, quite very low risk, I would say. Or going for a walk with someone. You're wearing masks, you're standing, you're at least a few feet apart, you're outdoors, there's some wind. We're talking about a very low risk activity. And then you could think about a group gathering outdoors, let's say a picnic. And then we start to get into, well, it's not, that's a higher risk than the walk, but it's lower risk than the house party. And so you could think about this, the spectrum of risk where you can kind of put each activity along that continuum. So you can kind of figure out, well, you know what, if I just go for a walk with my friend, that's actually going to satisfy my need for social contact this week. And that's the lowest risk place I can be on the spectrum. And I can't just stay indoors, but I need to see some people. And so here's a way I can do it that's fairly low risk. And the other way that this can help people think about things is when they're thinking about, let's say, having an event like a dinner party, we can think about ways to reduce risk in every situation. Taking that dinner party outdoors makes it lower risk. People bringing their own food makes that lower risk. There are ways to reduce any potential harms in any of these situations anywhere on the spectrum of risk.
That question of outdoors versus indoors is something I've seen you talk a lot about. It seems like something of a theme through much of what you're saying and writing. And is it accurate to say that the more we understand about how this virus spreads, the more we're feeling that open air outdoor settings are less risky, and that the real concern is more confined indoor spaces? Is that a fair thing to say?
Absolutely. I think that's one of the most important things we've been learning over the past few months about viral transmission, and that can help give us a roadmap for how we can do these next few months, at least until we end up in the dead of winter, and then we're going to have to navigate that situation. But at least while the weather is amenable to our being outdoors, I think as much as we can take our socializing and our services that are typically provided indoors, like haircuts and exercise classes. It's tough in New York City, and I'm in a much less dense area, so it's easy for me to imagine those things. But as much as we can open up more outdoor space, I think that will help facilitate people being in a lower risk environment and being able to have some social contact while maintaining enough physical distance that it remains fairly safe.
Right, so something like a yoga class in a park is the kind of thing that we should probably be encouraging.
Absolutely.
And let's remember that one of the best ways you can improve your odds against this virus is to stay healthy as a general matter. We should all be doing that anyhow, but exercise is a great way to do that. We all should be exercising. It's very, very hard if you're barricaded in your home. There's only so much you can do with push-ups. But to get out in the park and move, or out on a city street, which we're closing down to cars to give people a space to walk and run and bike. I mean, that's really important also for your physical health and probably your mental health. And so great point about staying outside. So we have a number of questions which are flowing in. And one from Jiang Ming Fang Wu relates to public transportation, and this is really on people's minds. And so Dr. Marcus, how are you thinking in this context with what we're learning about things like subways and buses? How do you assess that, and what does one do to mitigate risk in those settings?
Yeah, I think we still have more to learn about that. But I think, when I think about public transit, I think about the need to wear a mask and be conscious of things that you're touching. Those are kind of the two key ways that you can minimize risk in that situation. Another thing you can do, we want to generally avoid crowds. So if you're able to take public transit off peak hours, that's another way to reduce your risk. And I did just see this study out of Japan suggesting that maybe public transit isn't as much of a concern as we would think, because people are not generally talking. There's potentially less droplet transmission than you would expect in, let's say, a church setting where people are singing. But I think in general, those key points of masks and trying to be off peak hours to minimize your exposure to crowds are going to help you.
This point about mass transit, it's for us, it's really life or death in New York City, perhaps as much as anywhere in the world. And so, boy, there's been a lot of buzz in the last couple of days about some things we're learning about Asian cities like Tokyo and Seoul, which just haven't appeared to have a lot of spread in subways. And so people really are speculating that, maybe it's because people generally on subways are sitting and reading or looking at their phone or meditating or sleeping, and they're not engaged in as much conversation as you would at a party, for example. And you mentioned singing, and there's been a few highly publicized cases, you might call them super spreader events, where one person infected a lot of people at choir practices. And it does seem like, am I right that we're understanding that kind of close talking, perhaps especially loud talking, and especially singing might be one of the drivers of the spread? And if so, what does that say about a house party, about a bar, or any other setting where we're close together like that?
Yeah, that's exactly right. I mean, that's why those enclosed environments where people are talking and singing, or maybe even doing high intensity exercise, those are going to be higher risk situations where it's easier to have a concentration of droplets and virus enough to make transmission happen. Whereas if you're just sitting quietly on the train, there may be less opportunity for that to happen.
Right, absolutely. So that means gyms, we may need to be cautious about the heavy breathing in that context. But I think someone who was following your lead on harm reduction was looking at bars and even house parties and saying, okay, you probably shouldn't be having a house party, but if you are going to have one or attend one, then try and avoid the loud music, because that will mean you won't have to talk as loudly or as closely to the other person. And I heard that posed as a way for bars to think about their business model going forward, because we've all been in these parties and bars where if you're not 6 inches from the other person's ear, you're not going to communicate. Well, personally, I could do without the loud music if that made us safer. So definitely something to think about. So we've had several questions that relate to the touching of surfaces. And this has actually been a topic since the first moment we learned about coronavirus. Can you explain what a fomate is and the extent to which our understanding of that is evolving at all, or is it pretty much as we understood it 2 or 3 months ago?
Yeah, fomite is an inanimate object that becomes a vector of transmission. So think about a doorknob that somebody who's just coughed into their hand opens the door, and then you open the door and you touch your face, and that doorknob was the fomite in that situation that allowed transmission to happen. And from what we know right now, and I think it's been fairly consistent over the past few months, it seems like fomites, or transmission from touching surfaces, it seems to be a relatively small contribution to overall transmission. It doesn't mean it can't happen, and it doesn't mean you shouldn't be conscious, especially on places like public transit where people may be touching they're high touch surfaces. Lots of people are touching the same surface. So bring hand sanitizer, have it in your pocket, make sure you wash your hands before you touch your face. All those same kind of rules apply, but in general, it seems like transmission is more likely to happen through close contact with an infected person than it is through touching surfaces.
That is an important point to make. We need to distinguish between saying something is no risk and low risk. And I don't think any scientist would say that touching surfaces that someone with the virus touched prior to you is no risk. But I think we need to put it in context. And the way that I've heard our health commissioner, Dr. Exeris Barbeau, explain it is, yes, there's a risk there, But as we understand it, that's not what is really driving the major spread of the virus. And again, it does feel like it's close, sustained contact between people, often in home settings or other settings where they're indoors, they may not be wearing masks, and they're not just walking by each other on a city sidewalk or in a park. It's more sustained. So Laura Friedman asked about takeout food, and other people sometimes ask about packages and mail they bring in their home. I don't want to take you too far down the rabbit hole of getting specific on some of these things, but would it be fair to say that, considering what we just said about fomites, I had mispronounced it, fomites, that those probably are not the higher risk types of activities?
Yeah, again, I mean, it's theoretically possible that your takeout container or a package or your mail could have some viable virus on it, but there would have to be a whole chain of events that would need to happen in order for that to be the case. And we also know that the virus, even if it is on a surface, it doesn't, it decreases pretty rapidly, the amount of virus that's on there. And so by the time something enters your home, it's unlikely that it's going to be able to become a fomite or a source of transmission. So I don't think there's a need to kind of obsess over it, but it's just just when you open your takeout containers, wash your hands, get rid of the containers, wash your hands before you touch your face or anything else in your house, and then you're probably good to go. I don't think it's necessary to decontaminate everything with disinfectant wipes. If it makes you feel better, that's fine. Just don't use any kind of cleaning products on actual food like produce.
Right. I occasionally you see reports about how the virus can live on certain surfaces for a long time, hours and hours, sometimes even days on end. But generally, those are done in laboratory settings where the conditions are quote perfect, if that's the right word. Not in the real world where, I don't know, wind could blow or there could be other things that would disrupt the virus. Again, we're not talking about zero risk from surfaces. It's really important. And what Dr. Marcus is saying about being cautious there, about washing your hands, about avoiding touching your face, remains as important today as it was when we started giving that advice back in March and February. And in fact, one of the advantages of wearing a mask or a face covering, and we say face covering because you could have a bandana or a scarf wrapped around your nose and mouth and get a lot of protection. One of the advantages there is that you're just less likely to touch your mouth and nose, and that also can reduce risk. Now, I want to point out that we prepared a helpful guide to 9 social situations that you might find yourself in, inspired by Dr. Marcus. I tweeted this out over the weekend, and we prepared a multicolored PDF that we used, Dr. Marcus, some of your traffic light colors. We're going to show it to you just hot off the presses today. But we go through questions about, and I'm happy to talk about some of them here if it's helpful, but having a picnic with friends, having a play date with kids, visiting elderly parents, and maybe I'll talk through some of them, but I want to point out that we did, based on consultation with experts, prepare a little guide for you in these 9 situations, and perhaps we can have it linked into our chat right now for anyone who hasn't seen it. But one might ask why a city council member needed to do that. Why didn't our CDC do it? We do have a national government here, last I checked. And my goodness, this just strikes me as an enormous failing of the federal government to communicate any kind of nuance. Someone who described the recent guidance document from the CDC, which I think we understand was severely watered down, someone described it as like a recipe for making a cake, which simply read, make a cake. And if that was you, I apologize for not giving you credit. Was that you, Dr. Marcus? Okay.
Not me.
But I think you subscribe to the sentiment. Do you have any idea why it is that we're not getting guidance on this from the number one public health authority in the country? I mean, is this politically controversial? Or why not talk through with the public in an honest way about the relative risk of all these kinds of activities?
I don't totally know the answer to that question, but having spoken to colleagues who work at the CDC, I don't think it's for lack of effort on their part. I think we're in a really unfortunate politicized climate where the CDC has not really been allowed to do their job fully. And it seems like they're spending quite a bit of their time dealing with the politics of this rather than the public health effort, and have not really been allowed to be this public facing institution that they historically have been and that we've really needed them to be. And so that's, I think, where we need state and local health departments to step in to fill that void, and city council members as well.
Well, doing the best I can. I mean, to me, this is all part of the growing warfare between people who want to open everything up immediately and those of us who are advising caution. And for those like myself, and I'll let you speak for yourself, Dr. Marcus, but I think you're in the caution camp as well. You know, we say this is not all or nothing. We can absolutely take steps to returning to something like normal life with these kinds of precautions built in, with an understanding of the risk, with steps to limit the risk, and with some changing in the way we do business. Someone described it as the new abnormal. But it doesn't mean we have to stay locked in our apartments for the next 12 to 18 months until there's a vaccine. But to do this right, the public needs knowledge. They need to understand the nuance and the spectrum, and that's certainly what this is all about. So Jared Rich had asked us about kids, and I don't know if he's a parent, but I'm a parent. My kids are teenagers, a little bit older, but you know, kids also need social interactions, and it's challenging for them because it's not realistic that you would tell small kids not to get within 6 feet with each other if they're playing. And if you don't want to get into this specific, I'm happy to give some thoughts myself, but do you have any ideas on children and how we should think about risk and mitigating it with them?
Yeah, I mean, I'm thinking about this a lot. I have a 3-year-old and a 6-year-old. So I definitely understand where Jared is coming from. And I think we can, it depends on the ages of the kids, of course. A 2-year-old isn't going to understand social distancing. You can't ask them to stay far apart from other kids. I think my 6-year-old, I probably could have him meet up at a park with a friend and have them kick a soccer ball around. And that's a fairly low risk activity. And he understands the need to stay kind of distant, and that may work. You could also imagine going on a family bike ride with another family, and you know, having the kids ride bikes near each other and chat. So there are low risk ways to meet up. But if you're in a situation where you have kids that really either need to be closer to other kids or are too young to understand physical distancing, I think in that scenario, what we can think about is reducing your overall number of social contacts. So one strategy that is being recommended in certain provinces in Canada and in New Zealand as well, where they've done really well with controlling this pandemic, they're recommending a double bubble strategy, where one household decides we're going to basically have an exclusive relationship with another household, and we're going to talk about our risk and make sure that we're social distancing from other people, and make sure, you know, there's nobody who's you know, super high risk in that environment. And once you've talked about that and agreed to be essentially monogamous with each other, then your kids can play together and you don't have to worry as much about physical distancing. And I want to be clear, this is not a zero risk strategy, because every additional social contact increases risk somewhat, but it's a lower risk strategy than going back to, you know, your kids having a different play date every day with different families. If you just have that one family where the kids are similar ages, let's say, then that kind of gives you a way to give your kids what they need, while maintaining fairly low risk. Again, not zero risk, but low risk.
Well, every time I see Prime Minister Jacinda Ardern of New Zealand give a speech, man, am I envious. What it must be to have a competent national leader. But we digress. Yes, I like that term, the double bubble. I hadn't heard it before. And I think it's important to point out that anytime you kind of expand your social circle, I've heard people talk about this with a group of friends, like kind of make a pact with, I don't know, 3 or 4 friends that we're going to all be in each other's bubble, but we're not going to go beyond that. The challenge there is if one person violates the pact, then essentially the rest are at risk. But if the alternative is just unfettered social contact, then much better to give, you call it a pact, call it a double bubble, a shot, because you're going to get some of the benefit of social relationships, but a more defined risk than just blowing the doors open. So that's a really good way to think about it. So we have a question from Abby Cook Mack, good friend of mine, who brought up something I'm so glad she did. She asked about essential workers. And, as hard as isolating at home is or quarantining at home is, it really is a privilege.
Yep.
Relative to the heroes that are out there every single day who are taking risks to protect us, to serve us, to keep the city running, whether they are in healthcare or mass transit or laundromats or supermarkets. Almost every one of those jobs I just mentioned is indoors. And it turns out that most, not all, but most essential workers are working in the kind of indoor close quarters environments that we just said are more risky. And have you thought about what we could do to protect those workers who tend to be, by the way, more likely to be people of color? And this probably is one thing that has been driving the inequality of this pandemic. Do you have any thoughts on what we can do to better protect our essential frontline workers?
Yeah, I mean, I absolutely agree, first of all, that social distancing is a privilege, and that protecting our essential workers is not only an equity issue, but it's also, that's the way to interrupt transmission, because transmission, well, not just essential workers, but I would also add vulnerable populations who are in places like prisons, in nursing homes. Those are the settings that we need to be focusing on, not as much like picnics in the park, but these enclosed indoor settings. And so I think this becomes a policy issue around how to make these environments as low risk as possible, and also make sure that people have the resources that they need so that they can socially distance. What we don't want is a situation like the story that just went around yesterday about somebody who was continuing to give haircuts because he needed his paycheck. And he ended up, with linked to many new cases, and people were shaming him. But really, the shame belongs there on the failure, the institutions that are failing to protect him by giving him enough resources that he can stay home if he needs to. So I think that this becomes like a much bigger question about social support, policies around paid sick leave. I mean, these are all essential for our public health response.
It's so true. And as we enter contact tracing here in New York City, I'm not sure if you know that, Dr. Marcus, but this is starting next week. We're going to be asking people to quarantine. You're going to tell people who have an hourly wage, they're going to stay home for 14 days, they get no income. We need to expand paid sick leave. In the case of quarantining, we need to probably offer income replacement of some sort, because you could have a head of household who is the sole source of income, of livelihood for a family. And how can you ask them to quarantine under those circumstances? So, I mean, honestly, compared to some of the other challenges, paid sick leave is one that we should just fix. It's not a cutting edge technology. We just need to expand the system, which is already in place, to cover everybody. We really do need to do it as soon as possible. We've gotten a number of questions about elderly parents and more broadly just the vulnerability of people who are generally, you could say, over 65 or have underlying health conditions. And, you know, it's really hard not to visit your parents, or if you are a parent who's older, not to be able to visit with your kids or grandkids. It's tough. I mean, socially, emotionally. Um, and, you know, this is a tough one because the vulnerabilities are greater. But do you have thoughts on how people can reduce risk in relating to elderly folks?
Yeah, I think it goes back to what we were talking about before around thinking about outdoors as being a much lower risk setting, physical distance being important, and masks as well, and not sharing food. You know, kind of these basic things that we've been talking about all along apply even more so in a situation where there's somebody who's older or vulnerable for other reasons. So you can imagine a visit between grandparents and grandkids. And again, it depends on the age of the kids in terms of how much they'll understand the need to distance. But, you know, have a visit on the lawn where you have lawn chairs that are spaced 6 to 10 feet apart. You know, make sure there's a healthy amount of distance there, and wear masks. But it doesn't, I think telling people you can't see your grandkids for the next 12 to 18 months, especially older people who may feel that they're nearing the end of their lives, I think it then that becomes an unsustainable situation. And so we have to be giving these tips around, you know, here's a way you can do this that's fairly low risk. And of course, also I want to mention, of course, do not go visit somebody when you've been having any kind of symptoms. Or think you may have been exposed. That kind of goes without saying for all of this. Like if you feel sick, stay home. Or if you've been recently in a pretty high risk situation, wait a couple weeks before you go visit a grandparent. But that's I do think there are ways to minimize risk in these situations that we need to be making clear to people.
Yeah, we don't have a lot of lawns in New York City, or at least not in Manhattan, but some folks are lucky to have balconies or backyards, and others can access public parks. So there are ways to meet up outside and have the advantages of an open air environment.
And I'll add that, sorry to have the you know, the perspective of being in a place where you know, people have yards, and but I'll add that if you are visiting somebody indoors, then the masks become much more important. And to the extent that you can increase ventilation by opening windows, that can also help. But you know, masks and physical distancing and keeping your hands clean will all help you both indoors and outdoors. But the mask in particular is more important when you're indoors.
So Dawn Gresham asked about the idea of making space for restaurant seating outdoors as a way of reducing risk. And I'll just say that I think this is one of the ways we're going to save New York City. I think there's going to be a renaissance of outdoor space and public life on streets and sidewalks. And that to do that, we're going to have to reclaim some streets from automobile traffic, so that we can put cafe tables where a car might have parked before this pandemic. And, you know, I kind of like the idea of a city like that, where we're all together out dining in the fresh air. And the city council is actually working on a lot of policies related to this to make it easy for restaurants and cafes to get permission and licensing to do that, and to reconfigure the use of streets so that we can use that precious space for that purpose. I don't know if you have anything to add on that, Dr. Marcus.
I'll just say it's a great idea, and I'm glad to hear that you guys are working on it.
All right. Well, when we have such things in action in New York City, we invite you to come for a coffee and an outdoor cafe.
Sounds great.
So we've had a couple questions, and they tend to be from anonymous askers, which I understand, about dating and sex in the coronavirus era. And I'll just mention that the New York City Health Department was way ahead of the curve on this. They actually put out a guide, I think they called it Love in the Time of Coronavirus, on essentially how to understand the risk of of intimate contact in the context of this pandemic. And perhaps we can drop a link to this PDF in our chat right now. They put it out back in March, so they were pretty early. I understand they're actually working on kind of an expanded and updated version of that. But perhaps, Dr. Marcus, you could offer us a word or two on that. And this also might be a good opportunity for you to tell us about what you learned from studying HIV prevention, and to the extent that that's relevant to this question for coronavirus.
Yeah, I loved that guidance from the New York City Health Department, and in general, the health department where you guys are is, I think, really ahead of the curve on this stuff. It's a great example of what harm reduction guidance can look like. It makes it really clear what the safest option is, which they say you are your safest sex partner right now. And then it makes it clear what the next safest option is, which is a partner within your household. And for each, and then, after that, a partner outside of your household. And for each scenario, it gives you tips to try to minimize risk in every situation. And one thing I want to mention is something that is going on in the Netherlands right now. And again, that's a different situation in terms of what's going on with the epidemic there. But I think it's a good example of a harm reduction strategy. So they had said similarly, like, don't have sexual contact right now with people outside of your household. And there was a bit of a backlash to that from people who are single and maybe living alone, and said, sex is something that people need for a healthy life. And so we can't sustain, no sexual contact indefinitely. And so the Netherlands said, okay, why don't you get a sex buddy? And that became their recommendation, was
That's
pick one person.
the word they used, right?
Yes.
They called it a sex buddy.
It's a perfect example of a harm reduction strategy where they've said, okay, we recognize that not everybody can abstain from sex indefinitely if you're single and you don't have a sex partner in your household. So here's the next safest thing you can do, which is pick one person, communicate well about risk, and try to stick with that partner. And of course, maybe it doesn't work out, but essentially have one partner at a time and be communicating well about risk and what what else you're doing in terms of social distancing. And it's kind of like an analogy to that double bubble example where you've picked one household to be monogamous with. And so it's not zero risk, but it may satisfy some people's need for social contact, or with the sex buddy sexual contact, that makes it so that they don't need to have many sex partners, or they don't feel the desire to have a crowded party. It's a way of keeping risk as low as possible while fulfilling people's basic human needs.
Well, that's great to hear. We have had a number of questions. One is from Allison McDermott about schools, and we're thinking so much about this as we look to September and try to understand: can we reopen the schools? Should we reopen the schools? Under what conditions? And smart people I talk to are really directing us to rethink how a school building would look. And they're cautioning that really hard to see a return to regular school environment the way it was prior to March of this year. And they're suggesting everything from shifts where only half the kids are in the building at once, to extensive constant sanitizing. Considering what we've talked about so far about the relative risks of crowded situations and talking, the relative risk of touching surfaces, and challenges around young people, do you have any additional advice on how New York City can think about the school reopening question?
This is one I'm a little afraid to touch, because I think there's still more we need to learn about what kind of role kids play in viral transmission and how much closing schools really helps. I've kind of gone back and forth in my mind about this. The more I read about it, the more I'm unsure. But I do think what you're saying is true, which is that if schools do reopen, there are going to need to be measures to reduce risk as much as possible in those environments.
Well, we're going to keep struggling with this one. a lot's on the line. So we have an anonymous question about asymptomatic transmission. And, this really is something that has evolved since the early days. I think scientists always feared or suspected it was possible, but correct me if I'm wrong. I think we've come to understand more solidly just how much asymptomatic transmission there is with this virus. And I want to get your thoughts on that, but I want to bring up our strategy here in New York to try and prevent asymptomatic transmission, which is contact tracing. Right now, when we're out in public, we really have no confidence that the people around us are not contagious. They might not even know they have the virus, right? Because they could be asymptomatic. But if we're going to really start to reopen, we have to fix that. And the way to do it is through contact tracing. The way it works is everybody who gets a positive test for the coronavirus then talks to a contact tracer. And that patient explains who they've been in close contact with, which in New York City we're defining as 10 minutes or more at a distance of 6 feet or less. And then the contact tracers reach out to those individuals and they say, we know you don't feel sick right now, you have no symptoms, but there's a chance that you have been exposed and might have the virus. So we need you to quarantine until it's clear that you have not contracted the virus. If we do that and we do it comprehensively, then we're going to catch nearly all of the asymptomatic people. And that will be a game change for New York City because it's going to give you a lot more confidence that the average person you are interacting with in a restaurant or a workplace is not asymptomatic because they would have been caught through their contact trace. So that's a little far afield from harm reduction, Dr. Marcus, but do you have anything to add on the question of how we think about risk in a world in which someone might not even know they're contagious?
I'll just say I think it's our Achilles heel in a way with this virus, because you can imagine how much easier it would be to control a virus that is only transmitted when people are symptomatic. Then it becomes much simpler. It's like you have symptoms, stay home. And it's maybe there's household transmission, but it's much easier to control. So I think you gave a great description of why contact tracing is so necessary, especially with a virus that can transmit asymptomatically. And it also, I think, needs to be rapid. Like those contact tracers need to be calling people immediately and getting in touch with them as soon as possible, because every day that they're out in the world without realizing that they may be shedding virus is a day that other people may become infected.
Yeah, that's right. There's been a number of questions about air travel. I don't think I'm going to force you to answer that one, Dr. Marcus, unless you want to. It's probably a little more specific than you're interested in. But I'll just say that I know there's a yearning to, once again, spread our wings beyond New York City. And some of it is also about social contact. It's visiting loved ones who are a plane ride away. I think about that the same way I would think about a trip on a city bus or a subway. And it might mean that we need to have lower capacity. It almost certainly means everyone would need to be masked at all times. And if science really bears out this suspicion that things like talking are driving it, it might mean that we need to have less talking on plane rides. I'm speculating there, but I do know there's a lot of concern. Did you want to add anything to that, Dr. Marcus?
Yeah, the only thing I would add is beyond the risk of the traveling itself, one thing to think about is if you're visiting another family, or let's say you're going to visit older relatives, one thing you can do to reduce risk in that situation is to try to quarantine yourself for, ideally 2 weeks before you go on the trip. And if the other family does the same, then you've reduced risk, at least in terms of transmission to each other, with the exception of that plane trip where you might pick something up. But quarantining on either side of a trip, both before and after, can reduce risk of transmission overall.
So Laura Tavermina asked, we still don't have an HIV vaccine after almost 40 years. And so does that not give us reason for hope that we'll find a coronavirus vaccine in short order?
Well, I can't go into the details on the science there, but I'll just say they're very different viruses, and the fact that we don't have an HIV vaccine doesn't mean that there's no reason to hope that we will have a vaccine for this virus.
Do you think it's fair to say that we had inadequate resources devoted to the search for an HIV vaccine, perhaps because of homophobia or stigma around the disease in the early years or even early decades?
Certainly in the early years. I think now we've made up for that, and there's quite a bit of funding, I think, for HIV research, which is great. But absolutely, homophobia slowed our response to HIV in devastating ways.
No doubt, and there is certainly an unprecedented worldwide effort underway right now to find a vaccine for coronavirus. I think there's actually 100 different, if I'm not mistaken, 100 different research efforts underway globally, which is certainly unprecedented. And some appear to be making progress, which is encouraging. But I want to remind folks that when people talk about the timeline, the question we need to ask is not just when does science establish a vaccine as being effective and safe, because it has to be safe. The question is, when can you mass produce billions of doses of that vaccine and actually deliver it to regular people, potentially twice, by the way, per person around, the city, the country, and the world. And so I think we need to be a little bit realistic that to say that we're just a few months away from actually producing and deploying a vaccine, boy, that is really stretching it. Even in light of the encouraging news about progress in the research front. I think we should just prepare ourselves that we're probably 12 months away. We don't know, and it could be sooner. It also, by the way, could be later. But I think part of why we're having this conversation about a harm reduction approach to social distancing is because we are prepared that this might not be a quick fix. And if we are really 12 months away from a vaccine, or heaven forbid longer, then let's figure out a sustainable strategy. We had a question from Nancy Preston about antibodies and a question from Christopher Kelly about immunity, and they're somewhat related. And I realize this isn't your specialty. I'll just say a word about that, but I do have a question, I think, related to harm reduction, which is that antibody testing is becoming more accessible, and I think that's a good thing. In my mind, there are 3 reasons why it's good to get an antibody test and 1 bad one. So if you want to donate blood plasma, then that's a great reason to get an antibody test. In fact, research came out in the last week establishing convalescent plasma as an effective treatment for people who are still in the hospital. So I got a positive antibody test, and as did my wife. We had both been sick with the coronavirus, but didn't get a diagnostic test when we were sick. So we got the positive antibody, and we're going to be donating plasma in the next couple of weeks. So that's a great reason to get an antibody test. Secondly, it does help researchers understand more broadly the trajectory of the virus and how broadly it's spread in the population. And we think in New York City, it's probably somewhere between 20 and maybe 30%. Our understanding of that is a little hazy, but it's going to get better the more people take antibody tests. And lastly, I think it is legitimate to say, I'm just curious, do I have antibodies, as a hint of whether I have it. Here's a bad reason to get it. Don't get an antibody test because you think a positive result will allow you to stop social distancing, will allow you to stop wearing a face covering, or frankly, change anything about cautious behavior or medical decisions. In fact, the city health department sent out an alert to all the medical providers in New York City and said, don't use an antibody test as a reason to make individual medical decisions because of the number of false positives, because our understanding of immunity is still evolving. We do believe and hope that you'll have some immunity conferred by the antibodies, but we don't know for sure. So you can't take that as thinking you have magic armor. So you got to still be cautious, even if you get a test. But Dr. Marcus, in a harm reduction frame, is it legitimate to say, well, I've got the antibodies, so maybe I can tiptoe into the world of social interactions, or is that not the kind of thing we want people to even entertain? How do you think about this from a harm reduction perspective?
Well, but I think the science just isn't there yet to tell us what a positive antibody test means. And as you said, there can be false positives, and we just don't know enough at this point about immunity to, to have a test inform somebody's behavior. Harm reduction is still very much based on scientific evidence, and I think here the evidence isn't really there yet. And so we have to be very cautious and make sure that when doctors are doing these tests, they're communicating to people exactly what you just said.
We are almost out of time. We have time for one or, for lucky, two questions more. But we have a question from Oren Kotula about the decreasing number of people that we're seeing wearing masks or face coverings in public. And I want to give you an opportunity, Dr. Marcus, to kind of to square the guidance we're giving about allowing human beings to have some social contact with the need to see that people do continue to wear face coverings and practice social distancing where possible. Could you talk about how you navigate those two strains of thinking?
Yeah, I mean, I don't think they're different. I think actually masks become even more important if we're talking about people having more social contact. And I also want to be clear that I'm not necessarily saying people should have more social contact. I'm simply saying I think some people are going to need it and are already having it and are already thinking about how to expand their social lives. And so we have to give guidance like masks, guidance around these tips that people can use to minimize risk as much as possible if they do choose to have more social contact, which we know some people will.
Harm reduction, everything we're talking about here, this is about policy for the real world. This is not about policy in the laboratory. In the real world, in a city with 8.5 million people or a country with 330 million people, it's just not realistic that nobody's going to have in-person social contact for months and, God forbid, a year or more. It's just not. So given that, we understand that, and we've learned that this approach works from past epidemics like HIV, let's give people tools they're tragically not getting from the CDC, but let's give them the tools to understand the spectrum of risk and how to limit risk at every turn. We're going to squeeze two lightning round questions in here. So Barbara Rutter's asking, if a person has had contact with someone who's positive, why not just test that person instead of quarantine? This isn't exactly a Dr. Marcus question unless she wants to weigh in, but the answer there is that it's not entirely clear at what point after you've been exposed, you're going to start to show up with the positive diagnostic test. And so there's a little bit of concern that people who have really been exposed and might already be carrying the virus might not quite show up with a positive a PCR test or diagnostic test right away. So the safer thing, unfortunately, is to quarantine. And because the virus has an incubation period of 14 days, to quarantine for 14 days, watch your body for symptoms, etc. The whole topic of contact tracing is so huge, we can't tackle it at the moment. And we're going to do probably multiple other Q&As just on this question. But Dr. Marcus, did you have any thought on that question?
Nope, nothing to add on that one.
Okay. I want to thank you as we hit the 6 o'clock hour for daring to lead. We needed to hear your voice at exactly the moment that you spoke out. I have probably read your article in the Atlantic 7 times, and I glean something new every time. And now I'm going to read it in Spanish. And I encourage everyone who has a Spanish speaker in their life, or if you yourself can read it, to please do so. Are there any plans for translations into other languages by chance?
No plans, but if anybody wants to contact me
Okay.
to translate, feel free.
Well, if any pop up, let us know. We're a multilingual community and a multilingual city. I'm so grateful that you spent an hour of your time with us, Dr. Marcus, answering all these questions. I learned so much, and I know that our community did. We had, I don't know, something like 250 people joined us on the Zoom, and I think a couple hundred more on the Facebook simulcast. So thank you for your leadership and for sharing your wisdom with us today.
Thank you for your leadership as well, and thanks so much for having me.
Okay. Stay safe, and we'll be in touch. And to all of you, thanks for joining us. We'll be doing this again. Stay tuned for our next one. Be safe, everybody.